my dears, how are you? Today's topic is very interesting and you're going to be shocked. But what I'm going to tell you today will change your life or that of a close family member. Did you know that bad breath, bleeding gums, or even tooth loss can be symptoms of diabetes? Well, if left untreated, diabetes can lead to limb amputation, blindness, or even death. But what few people know is that you can recognize the signs of diabetes just by looking at your mouth. And this type of evaluation is often done by us, dentists. And today I'm going to give you 5 signs that you can recognize diabetes in the oral cavity. I'm Anamaria Chiaverini, and you're on Dr. Anamaria's Tips. According to the Brazilian Diabetes Society, the disease affects more than 13 million people here in Brazil alone. The problem with diabetes is that it's a silent disease and doesn't give many clues, unless you take a blood sugar test or take a good look at some signs in your mouth. There are several types of diabetes, such as type 1, type 2, and there is also autoimmune diabetes and gestational diabetes. There are many types of diabetes and each one has a different cause. Today I will focus on the most common type, type 2 diabetes, which occurs when the body does not make adequate use of the insulin it produces. This type of diabetes is directly related to being overweight, a sedentary lifestyle, high triglycerides, high blood pressure, and poor eating habits. Tell me about your health. How is your weight? Do you eat a lot of sugar or salt? Let me know in the comments. I will leave a special comment for whoever writes. Let's look at the signs. The first sign you can check for is dry mouth, and this condition is called xerostomia. The salivary glands produce little saliva in this situation, which makes it difficult for the person to swallow since the food is not moistened by saliva. If you have this condition, low salivation may be a sign of diabetes, but it is worth noting that there are other signs that you may present along with this. And it is worth remembering that not all diabetics have xerostomia. The second sign that a diabetic person may present are white spots or plaques in the mouth, on the buccal mucosa, that is, on the inside of the cheeks and in the corners of the lips. This happens because the saliva of diabetics has a high concentration of sugar, which favors the production of fungi that cause oral candidiasis or thrush, as many people know it. These plaques can be painful and can cause burning. In more aggressive cases, they can even make eating difficult. If you have any of these types of symptoms, you should seek the help of a dentist who will help you diagnose the condition, and you should also be monitored by a doctor, as we are dealing with a possible case of diabetes, and then other protocols should be followed. And what do you think of this content? I want to know if you are finding this information useful. If so, leave me a comment, like it, subscribe to the channel, and tell me if you have identified any of the symptoms I have shared so far. The third symptom is scary, and I'm going to shock a lot of people now. But many people think that losing teeth throughout life is a natural thing. But the truth is that losing teeth is not a normal thing. The natural thing is to have teeth until the end of our lives. Did you know that? Teeth that move around in the mouth or come out on their own can be a sign of type 2 diabetes. This happens because the sugar in saliva increases the number of oral bacteria that cause periodontal disease, which is what we call this type of condition. The fourth sign of diabetes that is also ignored by many people, even dentists, is bleeding gums. I'm not talking about a small, isolated bleeding gum, but rather the majority of gums presenting abnormal bleeding that is caused by an inflammatory process. Inflamed gums can be painful, but often the person does not feel pain, even if the inflammatory process is severe. The gums bleed spontaneously and worsen with poor proper hygiene. The person may have a buildup of plaque, which is food debris that remains on the surface of the teeth. It is soft and viscous, or the person may have tartar, which is a white stone that cannot be removed by brushing and requires a periodontal scraping. According to an article published in Cielo, many diabetics are unaware that good oral hygiene can be an excellent ally in controlling blood sugar levels and improving the quality of life of patients. That's right. And the article also reveals that in uncontrolled diabetic patients with poor oral hygiene, periodontal disease sets in more quickly and is more severe. For this reason, oral hygiene care goes beyond oral health, and it is through good hygiene that the onset or development of diabetes can often be prevented. The fifth sign of diabetes in the mouth is bad breath, or what we call ketogenic breath. Many people think that having bad breath can only be due to a digestive problem or poor hygiene, But there is a type of bad breath that has a characteristic odor. It is fruity. It is similar to nail polish remover, the famous acetone. And this type of smell occurs when the body burns fat to produce energy instead of carbohydrates. And this can happen in some other situations such as prolonged fasting, low-carb diets, and of course, in uncontrolled diabetes. So have you identified any of these signs in yourself? If the answer is yes, it is time for you to pay attention to your body and seek help from a health professional. Type 2 diabetes, which is what we are talking about today in this video, is a disease that can be reversible when it is identified and treated. And the main form of treatment is to maintain a good, adequate diet without refined carbohydrates or refined sugar. I hope you enjoyed this video. If so, leave me a like and subscribe to the channel. Kisses to you and see you next time.